Noswaith a chroeso pawb. Good evening and welcome, everyone. We're very fortunate to have two speakers from Cardiff University this evening to cover the topical and fascinating topic of artificial intelligence in medicine. Our first speaker is Dr. Athanasios Hassoulas. Athanasios is the director of the Hive Digital and Teaching Innovation Unit at Cardiff University, with Hive standing for Hybrid and Immersive Virtual Environments. In this regard, Athanasios has been tasked with overseeing the School of Medicine's digital education capabilities and innovations in high-quality teaching provision. This involves the uses and applications of technology-enhanced learning in all its forms, including interactive and engaging e-learning resources, physical immersive learning environments, simulation, virtual reality, and the use of generative AI. Athanasios is a Principal Fellow of the Higher Education Academy and a member of the UK Medical Schools Council Digital Education Steering Group. He is a reader and associate professor in medical education and teaches psychological medicine on the medical program as well as on various master's programs in the School of Medicine. He has published extensively and presented on technology-enhanced learning, virtual reality, artificial intelligence, and exploring innovative teaching practices that incorporate the student voice, which have also translated into national and international teaching awards. You're very welcome this evening, Athanasios. Our second speaker this evening will be Professor Marcus Coffey. Marcus is a professor of medical education and teaches the subject of pharmacology to our undergraduates on the medicine degree program. Understanding how drugs work is a vital component of training doctors to become safe prescribers. So to help our students learn about the drugs that can be used across all medical specialities covered in the course, Marcus uses a range of teaching techniques that help explain the effects of drugs. Marcus creates immersive and animated teaching materials that cover everything from cardiology to immunology to psychiatry, and this involves contextualizing the use of medications that target a specific system or tissue within the human body. Marcus has won a number of awards for his innovative approaches to teaching, and he has a particular interest in creating interactive, animated, and visually stimulating e-learning resources that medical students can use to enhance their knowledge of a particular subject area. So welcome to you as well, Marcus. Thank you very much indeed. Over to you, Athanasios.
Thank you very much, James, and thank you very much for the invite. So I'm very pleased to be delivering this talk with Marcus. So Marcus is Deputy Director of Hive, but very much, I would say, my senior in terms of his experience in this area and my mentor. So for me, it is an honor to be presenting this alongside Marcus, someone who has inspired me to explore the immersive and the interactive elements of teaching in further detail. So in essence, as James has said, our Hive unit is tasked with doing just that. We live in a changing world. I think that's something that's becoming clearer every day. And a big component of that is also technology and the role that technology will play in future professions and the way in which we even interact with ourselves, with each other rather. So just looking back at just 25 years ago, the Daily Mail, with its finger on the pulse, as always, predicted in the year 2000 that the internet was just a passing fad. It was on its way out. And I think we can probably agree that nothing could be further from the truth. The internet is very much interwoven into everything that we do. I mean, we can be delivering this talk remotely as we are without the internet. The internet has transformed our professional working lives, and it's even transform the way in which people meet each other. I think in terms of romantic couples, meeting online has far surpassed any other form of actually getting together and meeting your significant other. So the reason that I think it's important to highlight these kind of predictions that are made at times, and we've heard these as well with Gen AI, with generative AI and artificial intelligence in general. Is that people think that, okay, well, this is something that is not as big as it's being made out to be. It's just something that's being blown out of proportion. I think there may be a little bit of an element of truth to that, but at the same time, technologies such as AI have a much more powerful role to play in revolutionizing our lives, and at a much faster rate than, for instance, what the internet has achieved in 30 or so years. So going back to, I think, when the majority of us were um, I think with the majority of us in this room are old enough perhaps to remember, or I could be mistaken, when the internet first entered the home. It was a very different experience to what it is today. So, I think some of us may recall shouting at other people in the household to get off the landline because I'm trying to connect to the internet. So that's obviously not an issue that we have anymore. We walk around with the internet in our pockets, and we can search things that just pop into our minds within a second. Something that we couldn't really do just 25 or so years ago. And the use of the internet started to revolutionize the way in which we deliver teaching, and the way in which, for instance, if we're talking about medicine in particular, the way in which medicine was also practiced, and the challenges that medical professionals faced as well. And I think we've all very much heard about Dr. Google, and Dr. Google very rapidly became a practitioner's worst enemy. Everyone became an expert, and I think that is something that is going to be amplified with AI. We have people who, yes, do have vast amounts of knowledge at their disposal, but the question still remains, are they qualified and are they able to make sense of that information, and how do they actually apply that information to a given context and setting? So that's something that Marcus and I will dissect in more detail later. But just a few days ago, I was going through, and I don't know why, but I was going through some of my old material when I was a student, and I came across a handbook that I had for one of my modules. It was a module in philosophy of science, and I just happened to stumble upon this page, and I found it so fascinating. It was back in 1996 when Garry Kasparov, the chess champion of the world, spoke about his experience playing this Deep Blue program, this first artificial intelligence program that defeated a world champion in chess. And he describes it as the first time that he sensed a new and alien kind of intelligence. He admits that it felt at times, once he adjusted his strategy to counter the way in which Deep Blue was kind of making predictions based on moves that it was anticipating Gary would make. Once he adjusted for that, he did discover that it was a weird, inefficient, inflexible kind of intelligence, and made him think that perhaps he has a few years left as a world chess champion. I think we're at a precipice now. I think, and again, I'm very much not an AI expert, so I should say that from the onset. But based on things that AI experts are saying, such as Professor Geoffrey Hinton, who won the Nobel Prize in physics, widely seen as the godfather of AI, things are evolving at such a rapid rate that not even he was able to predict some of the things that AI is currently able to do, including being a little bit deceitful on training tasks so that it could perform better on the actual tasks that come after training. So we are seeing glimpses of this new and alien intelligence, and the question is very much on not can we stop it or should we stop it, but how do we work with it and how do we exert some control over it? Because Geoffrey Hinton puts it quite well. When it gets to this point where it becomes a super intelligence, what does that mean for us? Why would anything that is more intelligent than another species or other life forms want to be controlled by what it sees as inferior? And the only relationship that he describes in nature as being one where the inferior controls the superior is how an infant controls its mother. Other than that, we don't have any examples of an inferior life form controlling a superior. So there are a lot of important questions around how we actually use AI to our advantage and use it to enhance our skills rather than to kind of replace us entirely. going back to, I suppose, what exactly is artificial intelligence? There are a whole array of terms that I think are thrown around, from machine learning, deep learning, natural language processing. We've heard all of these, and I'm not going to bore you with the details. I'm not going to read through the definitions of what all of these are. But in essence, artificial intelligence is a combination of these things where we're looking at how we make machines learn from experience. In essence, we're looking at various models whereby we want them to be able to learn from information that is fed into the system and make judgments in future based on that information that they've been exposed to. So learning from experience, something that humans are very good at doing, or we may argue not so good at doing. In essence, we're trying to replicate the way in which the human brain works. And what has proven to be very, very effective is the use of language in terms of how these machines learn. So these large language models have demonstrated that artificial intelligence is very, very good at manipulating the way in which language is used. It's not so good at taking in information from the immediate environment. So when it comes to the information that we're able to process via our sensory, our five senses, we can take information in. I think it's estimated at 2 megabytes per second. AI currently can't do that, but when it comes to language and large amounts of text, it is very, very good at taking that information and manipulating it, and it's a lot better at sharing a lot of information and crunching that information down than we are. We're only able to share a few bits of information at a time. So me speaking to you, I'm only sharing about 100 bits of information with every, I don't know, minute or two that passes, whereas AI can do a much better job of that, trillions and trillions of bytes better than what I'm able to transmit. So whilst it has some limitations in terms of the information it takes in and its processing power, which Marcus I think will touch on as well, keeping in mind the brain only needs 30 watts. So it's really, really efficient in terms of how it runs on a little bit of energy. AI needs a lot more energy, but it's a lot better at transmitting information. So what we see when we play around with things like ChatGPT, or Microsoft now has Copilot, Google has Gemini, and so forth, we sort of see the tip of the iceberg. We don't really see what lies beneath. We don't really see all the hardware that's required and what's required to power these machines. We don't really see the libraries of information, the frameworks, the pre-trained models, and so forth. So we get to play around with a very nice little, I suppose, tool at the end of the day, which seems sentient, which seems to be able to converse with us, but it currently, there are some people who argue it may have elements of sentience, depending on how you define that. But my opinion is that it currently lacks that ability to actually have an awareness of what it's doing. It's very good at manipulating the information that's fed into the system. And when we're starting to look at how this is applied to medicine, we're looking at this spectrum of AI. So outside of the spectrum, we have automation, and automation has been around for a while. But within the spectrum of AI, we're looking at a spectrum that ranges from assisted intelligence to augmented systems of intelligence to purely autonomous intelligence AI systems that can adapt to different situations and act independently of human input if needed. And what we're starting to see, for instance, and I know Marcus is going to touch on this later, is the culmination of all of this when we're looking, for instance, at IVF. So in vitro fertilization treatment, there are elements. For instance, there was something published recently in one of the journals looking at how the first baby was born by IVF that was almost done entirely by machines. So we know for a while that we have had AI software in relation to embryo quality screening and selection. AI is very good at assessing embryo quality and grading the embryo based on the criteria that we set. It's much better than the human eye at doing that. But now what we're also starting to see is that if you bring in elements of automation, it makes the process of fertilizing an egg in a lab setting perhaps more accurate. It removes that element of human error. So automation alongside this array of artificial intelligence, be it through the software that we're using or what have you, it does look like there are applications and implications for medicine that we're facing in the short to medium term, and as Marcus will touch on as well in the longer term. So I'm not going to go into detail here because I know this is something that Marcus is going to touch on in more detail, but we know that currently there are applications with regards to imaging and radiology. It's very, very good at picking up on things that the human eye may miss. Genetics and genomics and sequencing, we know that it's used there. It's no secret, I think, that surgery has been making great strides in the use of technology and robotics. We're starting to perhaps now consider the integration of AI into these systems. And something that was published again just the other day was looking at how AI software can actually be used to develop, or rather to identify patterns that may be emerging when women go for their mammogram screenings, patterns that may be emerging that could potentially be indicative of breast cancer that could be developed. So kind of a prodromal period of breast cancer, which is very interesting because AI is good at making predictions based on the information that's fed into it. So again, there are an array of applications, but also implications for medical and healthcare professionals. So I don't know if anyone follows Dr. Glockenflecken on, I don't know how he pronounces his stage name, shall we say, but he's got quite a big following on TikTok. I don't know if anyone does follow him, but a few of us do. And this is a particular clip that he released. It's not a very long one, just over a minute, demonstrating, at least in a US context, in the United States, how some clinicians are already potentially playing around with some of these AI software applications.
All right, let's get started. How many patients were started on meropenem last night for community-acquired infections? None, sir. None. No, none. Not a single antibiotic stewardship emergency happened overnight. No patient was empirically started on ceftolozane.
So I think,
And bring your little precision friend.
so I think that kind of demonstrates where things could potentially be going. There are, I suppose, when we communicate to our medical students, some concerns over how this, I don't know much about this precision software, but there are some concerns in relation to these are still third-party owned platforms. So we, for instance, at Cardiff University School of Medicine, we haven't developed any of our own closed in-house AI systems, which means that whatever AI system we're using is owned by a third-party company, be that Microsoft or Google or whatever. How do they use that patient sensitive information? So there are some very important questions around that. And yes, they may claim read the small print, but at the same time, it still remains questionable in terms of what patient sensitive information can you feed into these systems and should you feed into these systems. And these are going to be very important questions that our medical students, trainees, and future doctors, future consultants rather, need to think about, reflect upon, and answer. So how does it actually think? Does it think in the way that we do? And the short answer to that is no, it doesn't. But we have tried to replicate these kind of sophisticated neural networks. So with the human brain, we have neurons, we have synapses, we have the flow of information through electrochemical processes. What we have with AI are weights and biases. So we have these nodes which are meant to replicate the neurons. We have weights that are influenced by training. So the more it is trained on something, it's sort of like long-term potentiation, the better it becomes at using that information. And there are biases inserted in that mix as well. Again, I'm not a computer scientist and I'm not an AI expert. My understanding of biases is that they're introduced as a constant, but exactly how they work within this neural network, I'm not entirely sure. And I think that highlights an important point here, is that we're using these machines, we're using these tools and these platforms, and we're not exactly sure how they're thinking or how they're producing the responses to the information that we're inputting. So it is an important consideration, and we're not expecting everybody to get a degree in computer science and become AI experts, but it is important to just acknowledge that we are using something that seems to do a very good job at crunching a lot of information in a short period of time. If we want to put in a lot of information and ask it to give us an overview, it's good at doing that. But we don't really know how it does it and why it chooses the specific kind of information from that it does choose. Now, what we've done in the medical school is we've started by looking at how we can integrate this into our teaching practice. And an important point to consider, I guess, is we're working backwards. So it's difficult to predict what medicine and healthcare as a profession will look like in 5 to 10 years. It's difficult to predict what it'll look like in 2 years, I think. But we're starting to think about what new skills will our medical students need to be competent doctors in this rapidly evolving world of medicine and how it's being practiced. So we're thinking initially along the lines of, well, we need to familiarize them with what AI is, the ethics that are involved with regards to AI. They need some understanding of the basic terminology and defining the basic terminology. And also then starting to think about how we can integrate this technology in a way that's responsible, ethical, and also enhances practice. So again, this is just a slide from a textbook that we're working on, and I'm not going to bore you with the details here, but we are looking at how we build AI information literacy into everything that we're doing in terms of training tomorrow's doctors. And it is a gradual process. So why do we need to consider this? So we've run a couple of studies at Cardiff University. One initially looked at whether our markers could identify if students or ChatGPT in this instance were writing reflective pieces. So I saw Mrs. X on the cardiology ward, and she presented with X, Y, and Z, and how did that make me feel, and so forth. You would have thought that if it's a reflection, ChatGPT wouldn't be so good at being reflective, but with accurate enough prompts, it did fool the majority of our markers. Now that demonstrates that as medical professionals, you could take shortcuts if you wanted to, but in addition, we know that our students are using this as a shortcut now. And the problem that we have is that reflective practice, for example, is a very powerful skill to have. It's a very important skill for students to have. And if they're using these new forms of technology and these tools at their disposal to bypass the acquisition of these skills, that presents serious problems for the future, because you're going to have non-reflective doctors, which is not a good thing. You may as well have a bunch of AIs treating you. So getting students to understand the importance of reflection is important, and perhaps this is an eye-opening experience for us. If they're using it to cheat, perhaps they're not understanding the value in these sorts of assessments. They're obviously there for a reason. If they're using shortcuts around reflective writing essays, then obviously we're potentially doing something wrong ourselves. And a study that we've been involved in, Marcus and I, which was actually led on by a group of our medical school alumni, looked at whether ChatGPT 4.0 could pass the medical licensing exam, or assessment rather, which all year 5 medical students or final year medical students throughout the UK are going to have to sit for the first time this year. And the exam is based on 5 domains of assessment. And what we found was that, yes, it passes both papers. It does better on diagnosis than it does on management related questions, but it's still able to pass. So what does this mean? Does this mean that AI, do you still need your doctor? Could you just use AI to get a diagnosis? The short answer there is no, because it's not using clinical reasoning to get to these answers. And this goes back to the point that Garry Kasparov made in terms of chess. It was coming to the right conclusion in relation to the move it was making on the chessboard, but it was using a different kind of logic. It was manipulating probabilities and previous experiences, whereas our students, we need to ensure that that clinical reasoning is sharpened, and that is what's driving their decisions and their ability to make an accurate diagnosis and treat a patient accordingly. ChatGPT and all the other platforms, they may be able to use language and manipulate language to come to the correct diagnosis. It's the right answer, but there are questions over how it got to that answer. And this is where we were saying to our students, yes, you can use it as an aid, but clinical reasoning is probably more important now than ever, because if you become over reliant on this, you can't blame ChatGPT if you misdiagnose a patient or if you're treating them for something that, again, goes back to misdiagnosis. But we also know the important limitations here. So we know that, for instance, we've told our students when we try to look at whether they have used Gen AI platforms to put their assessments together, there are no tools or detection tools currently that give us a definitive answer as to whether ChatGPT has been used. So an example that I got from a conference, which I've shamelessly stolen and shared here, is that someone put Genesis from the Old Testament of the Bible into I think it was ChatGPT 4, not 4, an earlier version, my mistake, ChatGPT 2 or something to that effect. And got it to change it around a bit, and then fed it through all of these detection tools. And according to one of these gold standard detection tools, Genesis was actually most likely written by an AI bot. So either these detection tools don't know what they're talking about, or we have a larger existential crisis on our hand if they've identified the creator as their own kind. So my guess is the former, that these tools aren't currently as sophisticated as some people are making them out to be. But that doesn't negate the potential that's there. And the potential is something that is rapidly evolving. So I want to hand over to Marcus because I don't want to take too much of the time we have away from him. But just to give you an overview of how we're starting to integrate AI into our teaching provision at Cardiff University School of Medicine, we are starting to train students on for instance, the uses of AI. And we are starting to get them to think about, for instance, in modules such as when we're talking about the brain and how the brain learns and processes information, we bring in, for instance, AI and comparing and contrasting between what is different between the way in which you take in information and make decisions versus the way in which AI does that. And how does that influence decision-making processes that you as a medical professional will need? So on that basis, Marcus will take you through more of the applications and implications specifically in medicine.
Thank you, Thanasi. So just very briefly to pick up on what some of the themes that Athanasios has been sort of alluding to, is just this idea that AI is everywhere now, and we have to embrace it. We have to realize how it can be integrated. And I think, embracing it means understanding its potential plus its limitations. And what I'll do over the next few slides is try and give as balanced a kind of view as possible, and also put my hand up and say I'm a non-clinician. I'm a medical biochemist by training. I teach pharmacology to medical students, but I'm not going to try and give clinical insight because I don't have clinical insight, and certainly very happy to hear any of the respondents and attendees kind of questions and thoughts if you are a healthcare provider at the end of this. So just to pick up on a few of the things that we're doing in the curriculum, we're trying to embed more of this technology enhanced approach to our teaching activities. And this is just an example of a VR immersion suite that we've got for some of our undergraduate teaching activities. What we're trying to do with our students is make sure that they are equipped with the tools that they need to not just practice medicine, but also understand how technology is going to be more and more a component of their clinical practice, with one eye on the fact that we need to be careful about over-reliance and also potentially de-skilling. If we're talking about AI systems that, for example, are able to reflect, are able to analyze, does that then mean that our doctors of the future will lose those critical analysis skills and critical evaluation skills that are so pivotal to being the part and parcel of a good clinician? So one of the things that I'm going to try and do to you, and bear with me because I've got lots of different computers on the go here, is give you some examples of how AI can be used within clinical practice and from the perspective of training purposes. And one of the things that we're interested in looking at in Cardiff Medical School is this idea of AI patients, and AI patients as a means of training. And the emphasis here is that we're never suggesting that an interaction between a student and an AI patient is going to be a substitute for the real thing. But what we are suggesting is that the ability to interact with an AI patient will at least familiarize and orientate students when it comes to developing some of their communication skills that are required for being a doctor. History taking, breaking bad news, awkward conversations, difficult conversations. These are things that if we can preemptively allow the students to gain a little bit more confidence in developing those skills, then when they actually interact with real patients, which is the goal, they are a little bit more better equipped and confident with those skill sets. So I'm going to try and demonstrate one of the AI patient platforms that we're looking at the moment. So there are a number of these AI patient platforms out there at the moment from all over the world. We're trying to pick a platform for our undergraduate medical students that is going to be appropriate for them. So perhaps, you know, a UK-based slant on it. So I'm going to try, so bear with me, to share my screen. And this is a platform that will allow students to effectively have a phone consultation with a patient, and they can have a real-time conversation with the patient. So I'm not going to go through all of this. I'm just going to hopefully give you a little taste of it and hopefully be able to hear what's going on. So this is a patient called Adiola. She's 81 and she's got some problems with her pain in her leg and an ulcer that she's got. And the simulation will be the conversation that the healthcare provider has with Adiola. And the thing to bear in mind here is Adiola is an AI who is just going to respond to the questions that the healthcare provider actually makes.
Good afternoon. It's nice to be here with you. How can we get started today?
Hi, Adiola. My name is Marcus, and I'd like to know a little bit more about your healthcare problems, please.
Hello, Marcus. It's nice to meet you. Well, lately I've been having some trouble with leg pain that feels like a cramp when I walk. It's quite bothersome and makes it hard for me to get around. There's also an ulcer on my big toe that just won't heal. No matter what I've tried over the
Sorry
past
to
few
interrupt
months.
you, Adiola.
What would you like to know more?
Could you tell me a little bit about your medical history that might help me think about what treatments might be suitable for you, please?
Of course, Marcus. Over the years, I've been managing type 2 diabetes. That was diagnosed about 20 years ago. And I also have high blood pressure and high cholesterol. I take my medications regularly for all of those. Other than that, I had my appendix out when I was much younger, but nothing else major. Is there anything in particular you'd like me to elaborate on?
Thank you, Adiola. That's very helpful information. Could you tell me what medication you're taking for your diabetes, please?
Certainly, Marcus. I take metformin, 500 milligrams twice a day for my diabetes. I've been on it for quite some time now.
So, Thanasi, do you want to reshare your presentation? And while you're doing that, I'll just talk through what happened there. So I think you'll probably agree if you heard that. That was a pretty realistic conversation with actually, Thanasi, let me share it actually, because I'll do it from my presentation. Okay. Yeah, there you go. So that was a pretty realistic conversation that you'd have with, let's go to there, let's go to there. Okay, I think we're back in the room. So it's a little bit complicated jiggling all these windows. So that was just an example of how we can use AI to allow students to develop some of their communication skills. As I said, never a substitute for the real thing. This is only a prelude to the real thing. And I think, having a play around with these platforms is incredibly useful because the students have access to these kind of platforms 24/7. And again, it brings them a little bit more confidence. So The other thing that we're seeing AI have quite a big impact in is not just in terms of the artificial patients that we can create and use to develop students' comm skills. It's also as Thanasi alluded to, its functionality in screening and prediction. And there's certainly a lot of use of AI now in mental health conditions. And there's some of the interesting papers that have come out in the last few years have been using large language models as predictors for certain mental health conditions. And perhaps more interestingly, the flip side of what I just showed you in terms of an AI patient is that we're now, and this is very hot off the press, we're now thinking about how AI can be used as actual therapists. Now, again, a lot of you may be sitting there thinking, well, is this an example of AI taking our jobs? At the moment, the way that the AI therapists are being used is as a bridge to being seen by a human therapist, a human healthcare provider. But you may well be aware that in the UK, at least, waiting times for a routine referral for something like cognitive behavioral therapy can be extensively long in terms of perhaps, 12 to 18 months in some cases. And that sometimes forces a different treatment regime that might not be suitable. So as a pharmacologist, I'd far rather that people didn't use pharmacology because there's side effects of drugs and all of that. And certainly cognitive behavioral therapy is one of those things that's superior in many ways to pharmacology for certain mental health conditions. So these AI therapists are being used to incredible effect now. And this is just one example that came out very recently, a couple of weeks ago, where they had an AI bot that was acting as a CBT therapist effectively. And the take-home message from the patients that were actually involved in trialing this AI system is that their depression symptoms reduced, their anxiety improved, their eating disorder components substantially decreased, they engaged with the AI system, and what was really interesting is that they formed a therapeutic and professional relationship with the AI that was very, very similar to the type of relationship that they'd form with an actual therapist. So in addition to having like the AI patients that are great for training, we're now taking that next step into thinking about, can AI be used to actually deliver certain aspects of healthcare, but as a bridge to being seen by an actual human healthcare provider. And one area of AI use that is particularly close to my heart is as a pharmacologist, one of the things that we are always interested in doing is developing new drugs. And one of the things that always takes humans a long time is to think about candidate drug molecules. So when we talk about a candidate drug molecule, we're talking about something that might have the potential to be useful down the line. And when you are designing and developing new drugs, one of the key things that takes the time is to consider the 3D structure of a drug that is going to target something in a pathology. And historically, that is one of the components of drug design and development that has taken humans a huge amount of time. Now we've got AI. We can use AI very effectively and very efficiently to predict and suggest candidate drug molecules. So what I'm showing you here is what's very recently being published a year ago, in that using generative AI models to predict brand new antibiotics. And I'm sure you're probably aware that we're having a little bit of a crisis when it comes to our existing antibiotics, because the bugs that the antibiotics work against, the bugs are getting resistant to the antibiotics. So we desperately need brand new antibiotics. And we're not going to find many new ones. We're not going to create new ones through the historical methods. But what we are seeing AI do is trawling all the known information about existing antibiotics and then predictions about what a new synthetic antibiotic might represent. Now, it doesn't fast track the clinical trial component, which is to determine how effective and how safe the drug is, but it certainly shaves off a considerable amount of time during the initial drug design stage. So the AI is incredibly helpful from that perspective. And as Thanasi alluded to earlier, one of the things that AI is incredibly good at is fast and high throughput screening at high volume. So when we're thinking about screening and diagnostic tests and investigations, in parallel with the human component, if we've got an AI system in place, then it means that we can screen huge numbers of histopathology slides that may have aberrant features that might be missed by humans in terms of human error. And as Thanasi alluded to again earlier, this idea of using AI in components of medicine such as IVF, in vitro fertilization, where the AI models are very accurate in predicting things like embryo viability and therefore assisting that particular area of speciality. And the last one I'm showing you here is cardiology. What we're seeing here is a 50p piece. That's nothing to do with cardiology. That's just to give you some scale of what this device up here is called, the Reveal Link. That's called an implantable loop recorder. And it's a device that you can literally inject into your patient, and it will record their electrical activity in the heart and transmit that as telemetry to whatever. And that whatever might well be an AI system that will triage the electrical activity that it records, that this implantable loop recorder records, and the AI system can then triage to say this is something of a concern and pass it on to a cardiologist, a human cardiologist, or in fact actually work out that there's nothing wrong and it's something normal. So again, AI can be an assist in some of these screening and diagnostic components. And again, the pros are we don't have human error, we've got consistency, we've got accuracy, we've got throughput, but the cons, and again, this is where we start to chip away of the AI systems. They're only as good as the algorithms and the databases that they trawl. And it's the old adage that you get rubbish in, rubbish out. And if an AI system, an AI model is looking at a database and forming its output, it's learning from that database. If the database itself is flawed, then the outputs from the AI will be flawed. So your AI systems are only as good as the algorithms that we program and the databases that they use to actually gather the information from which they learn. And certainly at the moment, pretty much at every aspect of clinical medicine that has an AI assist or a parallel component always must have a human component, a specialist, to actually double check, triple check to make sure that there's nothing slipping through the crack and the AI systems aren't, for example, giving false positives. And I'm including this one in just very briefly to sort of to highlight the fact that I have an interest in medical illustration and animation because of some of the teaching methods that I use. And I certainly would not describe myself as a medical illustrator. I'm a pharmacologist and a biochemist. But in terms of perhaps thinking about the limitations and the threats of AI to those particular areas of medicine, science, and healthcare provision, the medical illustration, medical and scientific animation components, AI is getting to a point where it might be a threat to some of those professions, but it's kind of in limbo at the moment. I think Athanasios often uses a phrase which I'll blatantly steal from him. The technology at the moment is as bad as it will ever be. It's only going to get better. So what I did is that I asked the AI, this was a Photoshop beta AI generative AI model. I asked it to create some graphics for me, and this was the prompt I used for the first one, to create a photorealistic human knee. Did a pretty good job of that. That was the text prompt that I used, and that's what it gave me, and that was very helpful. That was for some teaching I was doing on musculoskeletal injury and anti-inflammatory drugs. And then I was doing some teaching on AI, generative AI system, to create a graphic for me showing how lactic acid was being neutralized by hydrogen carbonate ions, which is a pretty kind of fundamental part of biochemistry and much beloved by medical students all over the world, acid-base balance. And you can see from this picture, garbage. The AI system just about got its head around acid neutralizing alkali, and there's a little bit of effervescence here, but it looks like there's basically some hard-boiled eggs in there. So that wasn't particularly helpful. And then the last one, you have to look quite closely, but this is really bad. This is like something out of the movie The Thing. So I asked it, to create a photorealistic and medically accurate image of somebody having an arterial blood gas sample taken from their radial artery in their wrist. So a reasonably explicit prompt, and this is what it gave me. And if you look closely here, I just don't know what the hell's going on here. These aren't even fingers. This is some kind of alien kind of limb. It's not good at all. So it's not quite there yet, but it is becoming more sophisticated and advanced on a monthly, yearly basis. So does this kind of approach of AI present a threat to that particular aspect of medical and healthcare and science in terms of what the illustrators will be doing? Maybe. I don't really feel qualified to sort of like give a long-term prediction on this. But certainly just as a sort of a three-way example of the good, the bad, and the ugly, it is getting there, but it's not quite there yet. And this kind of just brings me on to very briefly this idea that AI systems will trawl databases. So they're not sentient machines, they're not thinking machines, but they are incredibly good at learning. And the more information that they can trawl, the better they can learn and the more refined their output is. And the problem we've got with AI systems is data storage. And the data storage requirements for all this knowledge that are going to be used are huge. And this is something that needs to be addressed because the current way of storing information with these always on computers, these servers, is draining a lot of energy and using a lot of energy. So projects like Microsoft's Project Silica are in place to try and address how we can improve the efficiency of storing all this information. I'm not going to play all of this for you, but what this is just Microsoft thinking about how they can store information in a solid state way. So they're using glass, silica, to actually encode what they call voxels, which is volumetric pixels. And it's a clever way of compressing large amounts of information into a small space on glass. And of course, glass doesn't require any energy to store the information. Once you etch those voxels into the glass, the information is stored in a solid state form. So in addition to thinking about creative ways of storing data, one of the more exciting versions is to actually consider using DNA. Now, the advantage to using DNA as a data storage device is that, as you all know, we've got an incredible amount of information, our own human genome, compressed into the size of a nucleus, a few microns in diameter. So DNA represents an incredible way of storing terabytes of information in the size of a pin. And what you're looking at here is just a sort of a simplistic walkthrough of how we would convert our computer data into a binary form that is then converted into DNA sequences. The DNA sequences are then stored, and you can store DNA desiccated, dried, and it's very, very stable. And then you can retrieve that information by then pulling out those DNA sequences and reconverting the DNA back into the binary code. The advantage is that you've got a massive amount of information stored in an infinitesimally small space. That's a fantastic advantage. The disadvantage to the system is that this process as it stands currently is not very quick for data retrieval. Because this is an organic biological process, data retrieval is actually quite slow. You've got to convert your information into the DNA and then reconvert the DNA back into the digital information that you can use in a computer. That isn't quick at the moment, but we're getting there. And I think something that we've both alluded to in this talk is this idea is AI green? Is it sustainable? Is it something that's ecologically sound? And the answer is absolutely no, it's not. It's the least green thing that you can think of. It's been in the papers today, actually in the press today, about how much energy AI and big data storage systems use, and it is worryingly high. So we're talking about really excessive amounts of energy that are used to maintain these data storage facilities, these always on facilities, these server farms that allow this instant access of data. They are incredibly energy resourceful. And we've got to think about how we can address that. And some of the things in the news today were putting these data farms on the moon in the icy vacuum of space so they don't overheat, and use solar power to energize them, and then use Wi-Fi to beam the information from the lunar station data control to Earth. All kinds of things are being floated. But what we do know is that AI is incredibly damaging to the environment. It's not an ecologically sound solution. And that is an issue for us all when we're thinking about how we use AI, not just in science and medicine, but in AI in all parts of our life, because at the moment it's incredibly damaging to the climate and energy intensive. So I'll hand back to Thanasi now, and if just to finish this back, so you go. So you should have control of that now, Thanasi. Yeah.
Yes. Yeah, I think I do. Thank you, Marcus. So as Marcus has highlighted, there are clear applications in medicine, healthcare, and broadly speaking as well. So the starting point for us, and we've been very lucky to work with a very good central AI and education team at Cardiff University. We've looked at the guidance that the university has put forward, and on the next slide you'll see how we've tailored that for our medical students. But we've also introduced, two of our colleagues who are machine learning experts in the School of Medicine have introduced workshops on how to utilize AI in improving productivity and efficiency in the workplace. So we're starting to get those conversations going in terms of how we can integrate AI into our practice without over relying on it, and using it responsibly in a way that improves what we're able to do and the time in which we can do it, without obviously undermining our own position in the process. So if anyone's interested, we have an undergrad and a postgrad manual, shall we say, or an e-guide for students in terms of what is considered responsible use and what isn't, and we have some instructional, or not instructional, but rather videos where we talk through certain elements of AI uses for them, and we have HEIW, Health Education Improvement Wales, also inputting into that in relation to their AI policies, which are developing as we speak, as everything is in relation to AI. So we do have some information there in terms of how we're starting to prepare our students, starting to get them thinking about the uses in their studies and beyond. And something that actually, it was Marcus and I who were doing we were invited to a podcast interview by a student society, and one of the questions was, will AI replace, their question was doctors and lecturers. For the purposes of the slide, we've kept it to doctors, but I think the answer is the same. I think currently no, that's not looking very likely. That's not to say that it won't be likely in a decade or two, who knows, but currently no. I'm not that confident in a decade either they'll necessarily replace us, but I think what is emerging to be the case is that those who learn to work with the machines and work with the new technology will inevitably replace those who just outright refuse to embrace the use of the technology in the workplace, because it is coming. It's up to us now to decide on how we use it in a way that improves medical practice, that improves the way in which we deliver material, and the way in which our students and trainees also prepare for their future. So Kevin Kelly, the author, put it very eloquently, I think, when he said, this is not a race against the machines. If we decide to race against them, we will lose. It's a race with the machines, and we'll be paid in the future based on how well we do work with these invisible co-workers. And I'll hand over to Marcus for this slide, because we actually presented it at a student conference recently, and I think it demonstrates a point very nicely.
Yeah, I think this is the final slide really, and it's just to sort of I think because AI is now everywhere, and it is certainly going to feature and is featuring more and more in healthcare and particularly medicine, we have to embrace it. We can't stick our heads in the sand, as Athanasios just said, but we need to be aware of not just its potential, but also its risks. And there may be unknown risks at the moment. And what you're looking at here is a great photo that I always use as an analogy, which is these are two guys back in the early 1800s, just after Röntgen had defined and described what X-rays were, and X-rays started to be used in the context of medicine. And we all know X-rays are game changers, have been game changers in the use in medicine. But at the time, these two guys are actually taking a photo of their hands. One guy is actually put his hand on a photographic plate. The other guy standing up has got a fluoroscope. What they're doing is that you can just see this kind of glass bulb in the center of the photo here. That's flooding the room with X-rays, and of course they had no idea just how damaging that was to themselves, so they're killing themselves effectively. Now, there are some obvious parallels with the development and use of AI, and although AI might not give you a dose of ionizing radiation, it may well be using enough power to destroy a sun in terms of the energy requirements, and there may be unknown risks that we're not thinking about at the moment. So, I think that the cautionary message is we should embrace it and use this to help improve medicine and improve healthcare for patients, but we should also be always thinking about the risks involved as well. So yeah, I think that's probably, in terms of giving us some time for a few questions, might be where it's worth drawing a line under it. Is that okay, Athanasios?
Yes, yeah. I just literally opened the Q&A, so
Yeah.
I'm happy to go through some of those if that's okay. I see there are questions by Hannah, and maybe we can divvy them up. But obviously, if other people have questions, please pass those on. Is AI being used in detecting lung cancer in NHS Wales, as the survival rate of lung cancer is only 10% in the UK? That's a really good question. So I'm aware that I think NHS England was looking at this and may have adopted it, if I'm not mistaken, a year or so ago. And I know that DART, so Digital AI and Robotic Technologies, so that they're a group that involves Oxford Uni and various other institutions. They did quite a bit of work on this, and they demonstrated the power of using AI software in improving survival rates in lung cancer. So there definitely is an evidence base that is growing there, and I think NHS England have looked at adopting this. I'm not aware of NHS Wales having done it. I'd need to look into that, but I think it has been discussed across the border.
The second one from Hannah above it, which is if you're using an AI as a therapist, is it going to learn from your story and use your personal story to tell other people? It's a really good point. And then one of the things we often talk about when we're talking to the students about them using AI is that if you're using a third-party provider, an AI from a company or something that's an open AI system, you do have to read the small print and also appreciate how the data may be used and collected. And I know that companies like Meta, if you use the Meta AI systems, they will gather the data and they will use it for whatever. Now, again, that becomes quite significant when we're considering confidential and medically sensitive data that might relate to patients. So although there is clear evidence that these AI systems can work very effectively as, for example, CBT therapists, we do have to be incredibly careful about how that data that the AI system is gathering in terms of learning about the patient that it's providing therapy for, how that data might be used by the third-party provider. The solution to those kind of things is to have what we call closed AI systems, which are local to an NHS trust or a particular area where you can lock down what the AI system is actually having access to. Now, they're more expensive to implement because they are closed systems, but it does give you more control over where that patient data and that sensitive patient data might end up.
And that's a very, sorry, I'm just going through the questions as well, and it kind of relates to a query Lucy's just put in regarding hide the AI and listening to patient consultations and transcribing relevant points. So anecdotally, we know that some consultants are doing this as well, and there's always a concern as to, as Marcus has said, what platform are you using, and where is this actually being stored, and what is the company using that information for? Is it using it to train these we don't know what it's using it for, and I think that's another point that we've tried to illustrate to the students, is that yes, you can use this technology when you're, for instance, preparing for your ESCIs or what have you, or even when you're actually speaking to a real patient. But do you have the patient's consent to be recording them using these devices? These are important questions that I think, again, as is illustrated in this slide, I don't think people are purposely trying to create problems in relation to the way in which AI is being used at times. I think it's more lack of awareness in terms of, well, how is the information being used, and who's actually accessing the information via the back door? And sometimes we don't, have the answers to that either. It's a very important question.
So there are, again, just sort of go through a couple of them quickly. There's a question about geriatricians complaining about older patients having polypharmacy, multiple prescriptions for the various things they may be suffering from. AI certainly can help with that. That little video clip that Athanasios showed of Dr. Glaucomflecken with the American system is exactly designed to make sure that overprescribing doesn't occur. Polypharmacy can be reduced to where appropriate, and it's a third pair of eyes: the prescriber, the pharmacist, and the AI. But again, same issue as before. If that AI system is gathering data on what that patient's being prescribed, that's medically sensitive information, confidential data. So we do have to be mindful of how that data is being used. The question above it is talking about writing essays on biology in an effective way. Bad at writing essays, but love medicine. The guidance we give to our medical students is that there are ways that you can use AI to support the work that you're doing, but you can't use the AI to actually write the essay. What you can use the AI is to allow it to give you some prompts, some ideas, some themes that you might want to develop yourself. So as long as you're not using the AI system to synthesize, as in create from scratch, an essay that you then say, I wrote this, when that's cheating. But you can use AI to help you with the construction, the construction of the essay, and also you can use AI to do things like spell check and prose check, but you can't use it to synthesize the piece of work. The potential of future of AI in treatment of breast cancer. AI is going to be huge in all forms of cancer, for the simple reason that it's going to help with the screening process, and with drug development as well, drug design. So we're always looking for ways that we can tackle cancers from multiple angles. And if you look at how cancer is treated, it's whether it's surgery, radiotherapy, drugs, biological therapies. What you'll find with cancer treatments is that the more options you have, the more tools in your toolkit that you have to manage cancer, the better the outcome for the patient. Now, part of the management comes from rapid and early diagnosis, and that's where AI might be able to help. Well, it will be able to help, because it can do massive throughput screening with a high degree of accuracy with very, very little human error.
And I think
AI another... sorry Thanasi, yeah.
Well, I was just gonna, sorry Mark, I think in terms of screening, definitely, and if I'm not mistaken, I think I've read somewhere that they are using, or they are looking into how AI could be used to optimize things like radiotherapy. So I don't, maybe this is not specific to breast cancer, but it obviously can be relevant there as well, and also predicting patient responses to various treatment and management plans. So it does look, yes, currently it is screening, and that is important, but also looking at applications with regards to the treatment process itself, optimizing that perhaps.
So there's a question here saying, has AI become a normality in my field, in pharmacology? It's becoming more widely used, certainly in drug design and development. There's something that pharmacologists love, which is called QSAR, which is qualitative structural analysis relationships, where we look at the structure of a drug and how it behaves when we throw it into an in vitro system, and the effect of the drug And we have to think about the structure of the drug because it targets something, it binds to something. It might bind to a receptor, it might bind to an enzyme. And so the three-dimensional structure of it is incredibly important. And again, AI is something that is going to be, it is a game changer in terms of that qualitative structural analysis relationship. So I wouldn't say it's become normality, but it's becoming increasingly used. Can you foresee concerns about ambient AI, such as highly listening to patient consent, transcribing relevant points?
No, that was the one we.
As it could be true.
Yeah,
Yeah.
that was the one we
Yeah.
answered,
So yes. Yeah.
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 Yeah, and then there was
Um,
one. Sorry, there was one more. Hannah just highlighted there isn't currently in Wales the screening. So yeah, I don't remember hearing anything about that, but I think in England they did invest money in it at least. Whether that's been rolled out across the trusts, I'm not entirely sure.
Yeah, I mean, and Lucy Skinner highlighted an important point where, that if we're using AI to assist either the healthcare provider or, in fact, maybe to explain things for patients, we have to manage the patient's expectations as well. And again, put my hand up. I'm not a clinician. I just teach medicine, so I'm not trying to give clinical insight here because I don't have clinical insight. But I do understand as a patient the concerns that you might have if you're being told that an AI system is involved in your treatment. So I think it is incredibly important to manage the expectations of patients to say when, where, and how an AI system might be featuring in some aspect of their care, their treatment, their prognosis, their diagnosis, whatever. So I think that's a conversation to be had with the patients. By a human, not an AI, to actually talk about where and how AI might be featuring in their healthcare. What else have we got there? Given the sorry, James.
No, go ahead, Marcus. Yeah, there's a question about how we might assist patients in underserved areas. Would you take that one for us?
Sorry, yeah, where's that? I'm looking at that. Yeah, so how AI powered chatbots can help patients in remote or underserved areas access healthcare and advice to follow. Yes, I mean, obviously, during COVID, we all healthcare providers had to radically change how they interacted with patients, and that there have become a lot more phone consultations, video consultations, all necessary evils during COVID. But some of those things are still applicable as is ever going to get in the NHS. And there are certainly considerations where if you're in a remote area, it might be more feasible and pragmatic to have these kinds of remote consultations. Is AI going to help those advice? Probably, but my observation, living somewhere reasonably remote, is that you're always a hostage to things like internet connection, power supplies, etc. So technically on paper, I'd say yes, but there are the kind of the inconvenient truths that it only takes a power line to come down, or a storm, or your internet to knock out, to then suddenly lose this, and that comes full circle back to what we were discussing earlier, which is perhaps we don't want to have too much of an over-reliance on something that when it breaks down or it's not available, we're left flailing. So at the moment, I'm an advocate of having these things in parallel with the human element. So we're not de-skilling our human healthcare providers, and we've also got people that can fix things when they go wrong, and we don't become too dependent on these things, because if they suddenly disappear for whatever reason, we might end up being in a bit of a pickle.
Perhaps I could finish off with one more
Yeah.
question to the both of you, and that was, are we at risk of eventually reducing the critical thinking and judgment of healthcare professionals because of these fantastic resources, and how might we prevent that?
I'm happy to start that, and then Athanasios. I mean, we went to a very interesting talk a week ago from a colleague of ours, Professor Katie Webb, who was talking about just that, whereby we're all kind of talking about the virtues and benefits of AI, and clearly there are some big wins that we can think about. But she was talking about this idea of, if you have an AI system that is effectively doing the critical evaluation that we used to do you then de-skill that person, and they then again have an over-reliance on it? And I think the analogy that Katie used was a cell phone. And we how many numbers do you remember in your cell phone? And if you lose your cell phone, you can't remember all these telephone numbers. And it's a reasonable analogy, I think, in terms of if we have AI systems, sophisticated AI systems that are able to critically analyze and critically evaluate, then we run a risk of taking out a really, really vital part of being a good clinician and a good scientist. And again, I can't speak as a clinician, but I can speak as a research scientist. Critical evaluation is at the heart of all research medicine, all evidence-based research. So if you took that out, or if you lessened it, if you weakened it, if you withered it by using an AI, then yes, that does present a potential risk.
And I think, yeah, I agree with all of that. And I think it's also worth highlighting, it's not the first time we've had a very new and disruptive technology that has raised questions of whether large scale applications will undermine critical thinking. It's probably likely to be the most disruptive that we've come across yet ever. But even with the introduction of the internet and Google, not that long ago, there were queries, or there were concerns rather, over whether there was going to be an over-reliance on the abundance of information. And I think what we noticed is that the way in which the literacy that we were focusing on in terms of what we wanted our students to be able to do with that information was not so much just make sense of it, but also being able to synthesize that information in a way that was bringing in what was most relevant from those particular sources, identifying which are reliable sources and which aren't reliable sources. And that is going to be much more difficult now when you have more effective bad actors in the mix, such as the deep fakes that we've seen. But I think what's also important when we're talking to our medical students is to say that, yes, perhaps as resident doctors and consultants, you can be using some of these tools to enhance your practice. But for now, you can't really enhance a skill until you've acquired it. And I think that's the message we need to instill in students. You need to acquire these skills. You need to acquire the ability to, think critically before you think about how you're going to integrate these tools into your practice. It goes back to, I suppose, we can use SPSS now to crunch numbers. We don't have to go through long equations to analyze quantitative data. But at the same time, we need to be able to make sense of the test that we're using and what that test actually is telling us, and if it's the right test to use, and if the results are being interpreted the right way. So unless you have an understanding of statistical knowledge, you can't really interpret that. And I think it's going to be the same in medicine. Unless you've acquired those skills initially, using these tools will be meaningless to you, because you don't have the skills as your baseline. Some existing doctors lack critical thinking. After that, I can't comment on that.
Thank you both. I think we probably need to bring this evening's session to a conclusion now. Very much appreciated the sheer breadth of your insights this evening. It's been absolutely fascinating, and very much we're in debt to both of you. So thanks once again for a fascinating presentation that completes our series for this year. And I'd also like to thank our participants for their engagement and the provision of questions to our speakers this evening. So, diolch yn fawr iawn. Thank you very much, everyone. Much appreciated.
Thank you very much.
Good night.
Thank
Good
you.
Night.
Bye.
No start.